All right. Would you be able to explain the difference between a dietitian and a nutritionist?
Technically, there is not a definition of either. A registered dietitian is a very specific credential that means that very specific requirements have been met and an exam has been taken and passed. A nutritionist technically is someone who could read a book and say they're a nutritionist and then they can give nutrition information. So the problem with that is you have no idea what you're getting from that person or where they got their information. So by having someone with the credential RD, registered dietitian, you know that they have had the schooling and the experience, and then they have passed this national exam to make sure that they know what they're doing.
Okay, so even like the people on Dr. Oz, that call themselves a nutritionist, they don't really have credentials.
I always look to see if they have the word dietitian or if they have RD after their name, because just saying you're a nutritionist does not mean anything legally.
Oh.
So anyone who reads a book or takes a class can call themselves a nutritionist, and there are a lot of those people out there.
That's interesting. I didn't even know that. Because I was trying to figure out like if that would be a dietitian or a nutritionist, but
Well,
guess it makes
technically,
sense now.
just recently, our professional organization has said that we can use our RDN after our name now, which means Registered Dietitian Nutritionist. Because a lot of people didn't understand what a dietitian was, or a registered dietitian, they didn't know what that meant. But nutritionist is a common phrase that people use more often. So now we are allowed to put N after our RD. So, and I've been doing that, actually. That clarifies it when someone sees that you say registered dietitian nutritionist, then they understand suddenly what you do. So if that clarifies it for a lot of people, that's fine with me. I'm putting it after my name, it's fine.
All right. And then what educational programs are necessary for you to become a dietitian?
You have to have a bachelor's degree from an accredited university, and quite often the major is in dietetics, and then the minor for the degree would be in biology and chemistry. It's kind of a mixed biology chemistry. So you have to pass the bachelor's degree, and then you have to do an internship, which is actually getting time with patients, learning about teaching them and caring for them, and figuring out what they need diet-wise for therapy. That, and then after they finish the internship, there is the national registration exam, which is, you can take it online at any time. There's a fee for the exam, but then when you pass it, you are legally able to use RD after your name, and that truly means you have gone through all the steps, made it through, passed it, and you can be trusted for your information.
How long does it typically take you to get through all that?
There's two. You can do it, the bachelor's degree is 4 years. Then the internship is at least another year. There is something called a coordinated program where you would enroll in the coordinated program and you get your undergrad and your internship at the same time. It's a very heavy load because you're doing class work at the same time you're doing hospital work and getting to know the patient care area. So it's very hard, but it can be done within 4 years. It's really hard to do. Usually it's a bachelor's degree, and then you have after that you get an internship, and then you qualify, after you pass the internship, you qualify to take the RD exam. So it could be 5 to 6 years.
Oh, okay.
If you actually get out of your bachelor's in 4 years flat, then, but most people don't these days.
Yeah, yeah.
Really don't.
Besides the educators that come in for your credits, is there any other ways that you have to keep up with the education of the changing nutrition?
Technically, we can get our credits any way that would apply to our job and our nutrition. Actually, we can read books and take a test at the end. We can go to conferences, and we could take a computer class, if that would help your job. There's all kinds of things we can do now that are very different from just going to school or sitting in conferences. You can get credit if you are teaching or if you are giving lectures. There's a lot of different things that will count now for credit, but we're pretty much just, everything we do is trying to get that credit in because we have 5 years to get 75 credits. In general, when you're in a conference, each hour of it is an hour of credit. So if you have a whole day conference that's 8 hours and that would have breaks and it would have lunch, so you generally for a whole day conference get 6 credits. And depending on who is offering it, it can run pretty expensive.
Yeah. Is it, how often do you have chances to get the credits? Is it hard?
We get a lot of mailings just because professional organizations remember us and, send flyers every time there's something new in the area. It's hard to get out of work to go to a conference.
Yeah.
That's tough. It's a little bit easier to do it on your own time where you can read a book and then take a test and mail it back in and get the credit that way. Our professional journals usually have 1 credit in each monthly publication where you take a little test and send it in with $15 and then that's 1 credit. So there's a lot available. Unfortunately, a lot of it is the same all the time, so we're pretty bored with what's been out there. So
Yeah.
you can do things online too. There are companies that give credits and they do webinars, where you watch it on your computer, or you can do just reading it and taking a test. But there are live lectures, so there's a lot out there.
What does a typical workday consist of for you?
Here we have a computerized system for our charts. So there is one screen that would consolidate all of the people that need us to see them. So we print the list in the morning of the whole hospital and all the requests to see a dietitian or people who think we need to see them. And then we come in and we split the number of people that are needed to be seen by the number of dietitians that are here that day. So it comes out to an average of how many patients you need to see that day that's on this list. So we put our initials next to the ones we want to take, and that's how we do that. So through the day, you try to see them and complete the work for that patient. We can do that. That's our official list. Then there are the ones we're already following that we already saw once, and we need to maybe follow up a couple days later and see how they're doing. So we have that. And then we have one list that is generated by the hospital. When they come into the hospital, they get weighed when they first are admitted. If they are below a certain BMI, body mass index, where they are thin, we have to go see them and figure out why are they that thin. So it could be that they're not eating. It could be that they have a disease like cancer. It could be that they had surgery and they don't feel like eating, and so there's all kinds of reasons, but we have to investigate when we get that report. So there's a whole lot that comes in the morning. We choose who we're going to see, spend the whole day seeing them, and then we have to do either an assessment or a note in the computer just so that someone else knows we saw them. So everybody revolves around the computerized chart system. So the doctors look there, the therapists look there, we look there, laboratory looks there. Everybody looks in this electronic chart for the data about the patient. So everything we do must be put in there or it is counted like we didn't do anything.
Okay. What is the most common type of patient you work with?
In this hospital, we are a general hospital, or a community hospital. We don't really have specialty areas so much. We have different floors that are intensive care or mostly surgical. So 40% of the population is diabetic, so it's really common to have diabetic patients, very, very common. We also do see obese people, but not for the point of trying to make them lose weight. Because when you're in the hospital, you're usually sick, and that is not the time to get put on a diet. You need the energy, you need to be fighting infection, or you need to be healing. So we really don't see people for weight loss when they're inpatient. Very common to have diabetes, very common to have heart disease. We do not have eating disorders here at this hospital because we're the community hospital. So they have a special unit at the Royal Oak Hospital for eating disorders. And they have a dietitian that does eating disorders specifically. But we just don't have that specialty here.
Oh, okay. I understand that you may not be able to share too much about patients, but is there an experience you can share that sticks with you?
It's always a wonderful feeling when you're teaching somebody their diet for home, especially a diabetic, because that is such a traumatic diagnosis if it's brand new for them. They are afraid already. But if they can listen to me and follow me through this discussion of how they need to start eating, and when they at the end can look at me and say, that's not so hard, then I've done my job, because they are now with a good attitude towards something they need to do to keep themselves healthy and alive for the rest of their life. And if they got it and they understand it, I have done my job. That feels great.
Do you often have people that refuse to listen to what you have to say? And
A lot of times, older people or a lot of men actually say, tell my wife, she does all my cooking. My answer to that is, you do all the chewing and swallowing, so you need to know what's going in your mouth, and that is your job. So a lot of them try to push it off on somebody else, but really they don't. They do everything else. They brush their own teeth, they wipe after the bathroom, they do all those things for themselves. Well, they need to know what they're doing here.
What are your feelings towards advertised diets, such as Jenny Craig or the Atkins diet?
I think they're very convenient because they are delivered to the home, especially the, not Atkins, Jenny Craig or Nutrisystem, those kinds of things, where they automatically limit the amount of food you eat. No one can guarantee, though, that the person ordering it doesn't go out to McDonald's because their Jenny Craig is so small. So they really have not got accountability. You know, like Weight Watchers, at least you have to go and there's a group and you have to talk to someone, you have to weigh in, you can hear what other people are doing to get through it, and it's helpful to have the group. But when you're alone and on your own, nobody is keeping you to the diet, making you be honest and not cheat. So they have their positive points, but they really have some pitfalls. Atkins specifically is one that's very extreme low carbohydrate. So it's a little bit odd in that everything that you eat is protein. They say as much, eat a steak, eat all the bacon you want, whatever. I just don't think that makes a lot of sense cardiac-wise.
Yeah.
Because it's a little bit too much cholesterol,
Yeah.
even though the low carbs does make you lose weight. However,
It's not healthy in other aspects.
it's not terrifically healthy, but the minute you start eating carbohydrates again, you will get that back because it's really water weight. It is truly water that you're losing, not fat.
What are your feelings about foods that the general public sees as unhealthy? Do you eat them, and do you feel that people should eat them?
We tried to say a lot of times that there are no good foods or bad foods. Most of the time the problem lies in how much you eat. Even a diabetic, I can tell them they can use sugar, but I'm going to tell them how much, because it's not the food that's bad, it's eating it too much. So it's not fried that's bad, it's eating a ton of it. I personally do not eat fried, period. That's it. Not doing that. Too much fat. It's too many calories. So the food itself is not the bad thing. It's usually that it belongs with a whole diet that is all bad choices. If fast food is a habit, then it's usually too often, and you don't eat vegetables. And French fries don't count as a vegetable, I swear. You need fresh. You can go to even tell people, go to Wendy's. They have great salads.
Mhm.
They have a baked chicken breast that you can get honey mustard on. It's a wonderful sandwich. There are some healthy things, but people tend to just stick with fries and a burger rather than choosing a better thing at that place. Thankfully, the media is starting to really pound on them about all the fat and all the salt, and really people are starting to demand something healthier. So a lot of places are finding they can squeeze in apples in a bag, carrots in a bag. The salads are terrific. Some of them are great. Even Wendy's getting a baked potato. A baked potato is a healthy thing. It's not fried. It's a wonderful thing. So yes, it's most everybody's diet does include something like that because of convenience. If you don't have time to cook and you just have to eat, sometimes it's the fastest thing you can do. So it's not that the food is bad, it's just that the lifestyle, if it demands you do something like that, I'd be watching and making sure that you're choosing something a little healthier if you have to go to fast food.
Mhm. And then how flexible are you with the diets of patients? Like if someone's diabetic and they want a piece of cake on their birthday or something, do you make an exception or?
It's not an exception. We actually show them how to work that in.
Okay.
My diet materials actually have quite a long list of sweet things, and it just tells them exactly what a serving size is and then how they have to count it. So the difference between a piece of cake with or without frosting is the cake with frosting is twice what, sugar-wise, what the cake itself is, because the frosting is pure sugar.
Mm-hmm.
So you can squeeze that in, but you then can't have the second slice of bread, or you can't have the mashed potatoes. You know, they can make the choices. They aren't told. We honestly used to tell them they could have so much bread, so much meat, so much fat, so much fruit, so much milk. I mean, it was very, very regulated before. Now we've simplified and we just tell them the carbs are all you have to count. And so if you have tons and tons of carbs, I even tell them I have Pop-Tarts for breakfast. And I looked at the package and couldn't believe how many carbs are in there. Well, no, it's all sugar. So if a diabetic had to have Pop-Tarts, they just have to look. I teach them how to read the label and how to figure how many carbs it is. So if they choose to do that, then I need to have them accurately assessing how much is in there, so they don't go way over. Because if they did, then whatever medication they're on is not going to do the job to keep their blood sugar low enough, because they've gone way over. So they will have the high blood sugar and then possibly consequences from that. So I generally don't allow them cheating. I just teach them how to squeeze it in legally.
What are the perks of your job?
Free beverages in the cafeteria. Free coffee or tea. That's about it.
Oh, really?
Yep.
Well, what do you enjoy most about your job then?
What do I enjoy the most? I'm the coordinator for our interns, and they come from January through September. And I like doing that. I like teaching, so that does give me joy. And anytime I have to teach a patient whatever diet they need or guidelines they need, that really comes very easily to me. I like teaching. Other than that, I've been here long enough that I have a decent salary, and I am very pleased with my profession. I believe what I'm doing makes changes in people's lives and really hopefully makes them healthier if they follow what I tell them.
Mm-hmm.
So that's very rewarding.
What made you interested in becoming a dietitian?
I was actually, I started out going into business. I had my first Business 101 class. I was bored stiff and said, this is not for me.
Mm-hmm.
So I ended up in the general program. As a freshman, you have to take general classes, and so you take it from a whole bunch of different departments. And I happened to take a beginning nutrition class. And it was a 300 level, and I was a freshman. I got an A. I just took to it. I love science anyways, so it just was easy for me. And I thought, I can do this.
Are there any drawbacks to your job?
Well, we do get exposed to disease and bacteria and viruses and things that are floating around in the air here in the building. So that is actually somewhat of a risk, although we are really good about making sure that we protect ourselves. If someone is in isolation, we put on gloves and a mask and a gown so that we don't really get anything on us. And so we're very careful with sanitation and making sure that we ourselves don't get infected. They do have some, we have to do the flu shot every year. We're just really careful. The other thing is just working full-time means you live here more than you live at home, practically. It's just hard, because it's hard to have involvements outside of work, because you're here all day, every day. So you can't even get to the grocery during the daytime, during the daylight. That's right, because I'm here during all the daylight hours.
All right, I think that's about it.
Okay.